The insurance company, that they know that if they delay things long enough that you won't have a choice. You'll have
Right.
to take a lesser modality.
And then the insurance company can say, well, no, we never denied the case.
Exactly.
The patient chose to do something else.
They made a decision on their own.
Yeah.
I think that's 1/3 of all denials end up
And so how do you combat that?
speed.
Okay.
So it's holding them accountable to those timelines and then matching the speed. If ERISA says every 72 hours, your timelines have to be faster than 72 hours.
Okay.
So you have to get those appeal letters out the door. And it's a lot of work to cram into a short timeline. But what we've noticed is that at first, the insurance companies are typically like taken aback by our speed and the depth of our appeal letters. But over time, they start matching our speed because they know that we're not going to let them sleep on it.
Yeah.
And so that is the biggest factor when doing prior authorization, is having a process laid out and then following that timeline to a T, and do not let it slip because you will have patients that fall through the cracks. You'll have patients that get too agitated and stressed out, and they'll, rightfully so, they'll want to go either to another clinic or they'll downgrade their treatment. And then same thing with providers. Providers hate prior authorization. It's like, I want to say it's like 99% or 98% of providers say that prior authorization is like their biggest headache. You just have to have a really good process and follow those timelines because they will match your timing over time.
So you've spent a lot of time as you're navigating this process communicating with patients, and it's a high stress situation. Patient has cancer. They're potentially facing big medical bills. They don't know if the treatment that their doctor is recommending for them is actually going to get approved. And so, and just to put this in perspective, a course of proton therapy may cost $40,000, $50,000, $60,000. It might cost $100,000. It's a lot of money.
Yeah.
What are your conversations like with patients? What are you telling them to just help ease their burden a little bit going through the process?
Use a lot of data now because we have data that helps us understand what their likelihood of getting this overturned. We did a good job in the early days of Apollo collecting all of that. Now with Unity, we have a digital platform that we can actually show patients like, hey, this is your likelihood of getting approval, but also staying in communication with those patients at every step along the way. Because what happens typically in a community setting is that there's usually one person working on prior authorization, and they are completely overworked and overwhelmed.
Right.
And they don't have time to call every patient with every single update because they're in the community setting. They're trying to wear multiple hats, and there's just a lot of workload. With Apollo, what we did, we made it a priority, is we're going to let every patient know every 72 hours what's going on with their case.